Nababantu besibiza hospice. Nababantu besibiza. Bayasibiza hospice. Nababantu besibiza. Bayasibiza hospice. Bayasibiza, bayasibiza, bayasibiza.
The work that hospice does is palliative care, but the main thing, its concentration is on dignity and the human spirit, which must be celebrated at all times. All hospices are unique, and South Coast Hospice, over the many years, has developed various programs that fit and suit with the community as well as our own resources. The first thing that we do is home-based care.
Home-based care is the first port of call in assessing and managing pain and controlling symptoms of those suffering from a life-threatening illness. The hospice teams visit patients in the comfort of their own homes.
It isn't plain sailing, this cancer. Far, far from it. And all sorts of problems beset you. They give me ideas of foods that I should be eating.
The psychosocial aspect of hospice covers several different, important areas of well-being for our patients.
We talk about palliative care and you know that it's an integrated team. So we know that people aren't just their physical bodies, but they have emotions, they have a spiritual side, we're social beings as well. When you've been diagnosed with something like a life-threatening illness, you already start to go into grief. Hospice isn't just for end-of-life care. And if people can understand that our role is to walk this journey with them, it makes it so much easier for all concerned.
Hospice, bongisiza umawami, umawami kuvula, bamthatha ngiletha ngimina, ngasakwazi ukuyamba. Engisiza belo mbheka wagula bamthatha bamsesibhedlela eMashisini.
South Coast Hospice is committed on a daily basis to home visits for those suffering from multi-drug resistant TB or MDR-TB.
Every day, I use this bucket to visit MDR patients and patients with other illnesses just to keep their health, and the other teams are also doing the same. And they also give them hope in life.
South Coast Hospice, in partnership with Murchison Hospital, monitors and treats patients receiving a daily injection, which can have some debilitating side effects. All patients are initially assessed by a team, and their needs are then seen to by nursing sisters, caregivers and social workers, ministering to body, spirit and soul in life-changing interventions.
Engabe wafa ngasho njalo. Engabe washona ngoba ngendlela ebedinga ngawo usizo bese sikwazi ukumanage ukuthi simtholele amaphilisi simnikezele khona la endlini. Bese sikwazi ukuthola transport simthathe simise ko clinic. It's too far. Ngibonga kakhulu hospice ngokudlala indima yokuthi akwazi ukuthi amfikele endlini ehleli ngaphandle kokuphuma afuna izimali ukuthi ufuna ukugibela uye esibhedlela emaklinikhi umfikela nje endlini ehleli amnikeza usizo alidingayo.
I don't know how I can express myself that I can show that hospice is number one. Everyone that is like he's got MDR or anything else, so like HIV positive as I am. I'm so happy about hospice. They did well for me.
And then we started this palliative care. That's why this mobile is also here. We came as a partnership with South Coast Hospice that we need to offload these clinics. The long queues, patients will be waiting because there are patients that are real stable. South Coast Hospice mobile will be here. The sister in the clinic will have prepared the patient, all the medication. When the patient comes, everything is there sorted out. Then the patient, it will be 1, 2, 3, 1, 2, 3.
When disease and poverty are a fact of life, loss of loved ones is an ever-present reality. South Coast Hospice has several interventions to reach out to orphans and vulnerable children, helping them to heal and to learn resilience in the face of grief.
This is a memory box. Each child gets one.
So we encourage them to put their valuable things in the memory box, like a mother's ID, the pictures. So we just encourage children to keep things that are important to them into this memory box.
The Kingfisher House inpatient unit is a vital component of care. This is where gravely ill patients are assessed and where they have appointments with Dr. Andre Nell, attending to ongoing medical needs such as pain management and symptom control. There are 4 beds available for patients who need complex care or who have become too frail to stay at home. We also have the Rainbow Room, especially fitted for children.
That is what palliative care is. It means taking care of a patient with a very bad disease and taking care of the symptoms, making life easier for the patient. You have to have a unit if you want to do palliative care properly. You have to have a unit because you cannot treat everybody at home. It's too difficult. And the family, you cannot expect the family to do a lot of medical care. And the way that you die, there's the important thing. You can make it much easier.
Palliative care is a specialised field. In our training centre, we teach home-based care, HIV counselling, palliative care for professionals, and an introduction to palliative care. Students are also able to learn practical skills by participating under supervision in all our programs. Volunteer and permanent staff are trained in-house regularly.
I believe that a community would lack something without South Coast Hospice. We actually show the community compassion. We're a portrayal of what our community is, which is one of compassion and caring. And they need to value that. And they need to support it financially. We cannot do it without the help of our community. We can write away for money. We can go to the big foundations. We can go to the banks. We can do all of these things, but it's our community really that will be the poorer for it. So it is to the community we always turn, and I'd like to thank them for their continued support and not to give up on us. We will always be here no matter what form we take.
For more information on how you can be a part of playing an important role in the Ugu District community, contact South Coast Hospice Association.